Hi, I'm Harlan Krumholz, editor of JACC. I'm here with Kushal, Kadakia, deputy associate editor. JACC got some really good papers at this ACC meeting too, right?
Really on fire. JACC has over 20 publications being simultaneously published for this conference, but today was a
across
big day.
All the journals. I mean, all the journals have got content.
Exactly, but some really big studies today that I think we're particularly excited about. One I want to talk about is the 5-year outcomes of the Evolute trial for TAVR versus SAVR in patients that are low risk for surgery but have severe aortic stenosis. And that trial affirms the totality of evidence that we see that it's an option for patients that's equally good, whether you get a surgical intervention versus a transcatheter approach, but one that really shows the importance of doing long-term follow-up in these studies.
And since we know a lot of our patients would prefer to avoid surgery, as cardiologists, it's good news because it really shows that they're not sacrificing anything by going less invasive and getting the TAVR. We also have a couple of other good ones. We have ALT-SHOCK. I mean, I think this is a spectacular trial comparing intra-aortic balloon pump to traditional medical therapy patients with cardiogenic shock. And the result was?
It didn't actually work out. They actually just stopped the trial early for futility because it didn't meet its endpoint of superiority.
So this is a surprise because, in a lot of ways we think, put in a balloon pump, offload the ventricle, help people with cardiogenic shock. Didn't pan out here. I think most of the people on our editorial list are calling for more studies, but this is the best evidence so far. It's a small study, well done though, and
the first of its kind, the first time to have a randomized trial for this indication with this intervention.
So two more we got. I want to highlight. One is a brief report on RSV and the idea that actually RSV, if you get infected, increases your risk for cardiovascular events. Nicely done study in Denmark.
I think really interesting in particular that we now have also vaccines for RSV, which something 5 years ago primary care physicians didn't have their back pocket to counsel patients. And I think as we see these new outcome studies come out that really delineate this relationship between infectious disease incidence and cardiovascular disease incidence, it can help inform our understanding of what's the appropriate risk stratification and intervention in these groups.
So these vaccines are still relatively new. I'm waiting for now the next study to say whether people who got the vaccine, did they actually avoid these complications? They reduce their cardiovascular risk. I think it's going to be important to see, but it's no surprise, I guess, that an infection like RSV might do that. Final thing I want to mention is we have a study that is very interesting that brought together all the individual patient level data on the SURMOUNT studies. These were the studies of tirzepatide versus placebo for patients with living with obesity, and these studies largely had surrogate endpoints to see whether or not people could lose weight, whether they improved their cardiometabolic health. But here was the thing in this study, individual patient level that they got not through the company, but through another portal where they were able to get the study, and they were able to show the individual variation in the response to tirzepatide. So for the first time, you can sort of see that not everyone gets that average benefit. And you can see what's the distribution of benefit as people start on this medication, tirzepatide. I thought it was really a terrific presentation.
I think it was really well done. And I think this really adds to our theme at JACC about having this obesity revolution hub, which you can see on the JACC website, where we have data from all the different trials for the major obesity drugs that are out there. And as we see the new science, we can inform the practice, and that in turn can change how we can help patients live longer with drugs that initially were developed for diabetes, now being used for obesity, but we are really showing at JACC are really heart drugs.
And heart failure with preserved ejection fraction. We're seeing a whole range of things. This is an exciting area. We're going to be there. We're going to continue to generate the evidence. So exciting day for publications at JACC, and more to come tomorrow.